Imagine undergoing a hair transplant after a lot of deliberation, then waiting for 1 year to get your desired results, taking all the medicines, following all the instructions which your doctor or your clinic gave. But in the end, at around 12 months or 15 months, finding out that your growth is poor, your hairline looks very unnatural, people have started noticing this and then thinking, why did I do this mistake of a hair transplant? We understand your problem because we also do get a lot of patients like this who have undergone a hair transplant somewhere but are suffering from its poor or bad outcomes. Now let us discuss what common problems are there when you consider that the hair transplant is failed. The first and the most common which we see is a bad hairline. And what does it mean? A bad hairline means that either the hairline is very straight because naturally the hairline is irregular, but if you make your hairline too straight, it looks very unnatural. It is too low. There are multi-graft hairs in your hairline, like 3 or 4 hair grafts are seen in the front, which is again unnatural. Or there is a railroading, which means 2 rows of transplanted hairs is running parallel. So this is one of the common bad hair transplant which we see. Second one is a bad FUT scar. FUT scar sometimes can be very wide, very thick, and it can look horrible in many patients. Third most common problem is that clinic told you 6,000, 8,000, 10,000 graft. We know a patient, he said that a particular clinic somewhere did 20,000 grafts for him. And we could see his chest, beard, entire scalp was totally thinned out and it was looking very bad. And here also the growth was very suboptimal. So this is a depleted donor site, the third kind of washed up kind of hair transplant which we see in our practice. And the last one which we are going to discuss here is when the angles and the direction of the transplanted hairs is bad. Last but not the least is the poor growth. So the poor growth sometimes can be due to some skin problems, sometimes even due to stress. And this is a doctor will always discuss with their patient that this is a rare possibility. If you got your hairline unnatural, sometimes we have to extract these grafts, we have to take out these grafts. And this also holds same true for the bad angled or bad direction grafts. In both of these cases, sometimes we have to take out the grafts in such a way that your hairline start looking more natural. This may need more than one sitting at times. A bad FUT scar or a depleted donor site, what are the things which we can do? Say scalp micropigmentation.